Namaskar. Very, very good afternoon to all of my lovely audience. This side SHOMA CHATTERJI, founder of Seven Senses Consulting, which is for all of us, which is managing all your senses. हमारे 5 senses होते हैं. मैंने 2 senses और लिए. एक तो 6th हमारे intuition and 7th being a parental coach as well as a life skill advisor. आज मैंने सोचा कि मैं डॉक्टर शालिनी जैन, जिनका क्लिनिक आई केयर क्लिनिक वैशाली में है, उनसे रिक्वेस्ट करूं कि आज इस बहुत अच्छे दिन, जो आज वुमेन्स डे भी है और बाय चांस की बात है कि आज महाशिवरात्रि भी है, पे उनसे मैं जान पाऊं उनके थॉट्स एज अ पेरेंट, एज अ डॉक्टर, एंड हाउ शी इज बैलेंसिंग हर वर्क विद हर लाइफ. Namaskar, Dr. Sahab. Thank you so much for coming on such a short notice. And really, I'm very, very humble and grateful to you कि आपने मेरा invitation स्वीकार किया. Thanks a ton उसके लिए.
Thanks for inviting me, ma'am.
Yes, ma'am.
It's my pleasure. It's my pleasure to be with you. So please, whatever you want to ask, you can ask me.
Okay, ma'am. Thank you so much. Thank you. So, ma'am, शुरू करते हैं आपकी जर्नी से. आपकी जर्नी शुरू कहाँ से हुई?
As a professional career, ma'am, you can say I graduated in 1996. Then I did my PG and I completed my fellowship in 2000 from LV Prasad Eye Institute, Hyderabad.
Wow. LV Prasad Eye Institute. क्या बात है?
Yeah, Hyderabad. And then came back to North India and joined Dr. Shroff Eye Hospital, Daryaganj. I was there for 7 years, from 2000 to 2007. Then I took a small break as my daughter was and son was very, very, very young. Then I started my own clinic in 2010. And in between, I was associated, even I'm still associated with Yashoda Multi-Speciality Hospitals, Ghaziabad, Kaushambi, and Nehru Nagar.
Okay.
So that's how it's life till date.
Amazing journey, wonderful journey from LVPI till now. So, ma'am, as a parent, how you managing your life? My first question, being a parental coach.
Ma'am, in my life, if you ask me, I always kept my priorities, my family priorities on top. As my children grow, I started growing in my profession. Like when I joined Dr. Shroff, I was unmarried. Then I was there teaching head in Shroff Eye Hospital for all the fellowships programs and educational programs. Then my kids came, and then I thought that I am not able to, give a justice to profession and my kids. So I took a small break in 2007. Okay. I was appointed as a consultant in IGNO also, Indira Gandhi National Open University. So I did a I did a small, as a small job for as a consultant for making the, this academic curriculum for the professionals. And side by side, I was doing just 2 to 3 hours my partial clinical practice.
Okay.
Once I felt now the kids are grown up, then I started my clinic and partial Yashoda Specialty Hospital clinics.
Okay.
So I think as a mother, once we reach in a stage where we have to balance professional and personal life. So there are different priorities at different stage, and I try to balance both so that I should not leave my clinical skills and at the same time, my kids also not feel isolated. So I tried to do that. I don't know how much I have succeeded, but I tried myself.
No, ma'am, I really respect you because the way you have managed your clinic, I myself visited your clinic and found it to be very organized, and your kids are very much supportive of you. So hats off to that part. Hats off to that part. Ma'am, now kids are, during exams are going on, so kids are in lots of stress. So is that stress is also creating eyesight issues?
Sure, ma'am. It is actually directly related. So if we say, like, there are a lot of direct and indirect link between stress and the eyesight.
Mm-hmm.
Direct link is whenever we are under stress, our blink rate reduces.
Okay.
Once we are not blinking properly, our eye goes into dry eye situation.
Mm-hmm.
Once it is dry, we feel everything is blurred.
Mm-hmm.
Okay, because of the corneal dryness.
Mm-hmm.
At the same time, once you feel the vision is blurred, you become more stressed and the corneal haziness increases.
Okay.
That's the direct link. Indirect link means whenever we are stressed, there are components, there are synthetic chemical releases, which increases the anxiety. And during that anxiety time also, our blood flow increases, blood pressure increases, and sometimes that also causes transient blurring of vision. So
Okay.
stress and vision, it is directly and indirectly related. So we should be always calm. We should maintain the situation, because if the kid is under stress, the reading ability, understanding ability, that also reduces. So
Okay.
as a parent, we should always make our kids comfortable. Whatever they are doing, they should be comfortable. Stress reduces the effectivity and efficiency of the kid, and
Okay.
simultaneously the sight also.
So if they are studying in low light or not so very um, bright light area, that is also causing very much pressure on the eye.
Yes, ma'am. It causes pressure, and simultaneously a big pandemic what we are facing internationally is myopia progression.
Mm-hmm.
And one direct link of stress is with myopia.
Okay.
There are multinational studies. Those are showing that when the kid is under stress because of any reason, maybe it is dim light, bad posture, lack of sleep, lot of stress, it causes in the increase of minus number also.
Okay.
So that is definitely, as a parent, this is our duty to make our child comfortable for their better future. Not only in the in the terms of eyesight, it's in all the manner, like we should make them comfortable. Otherwise, we'll land into different secondary situations.
Which is very alarming, I guess.
Yeah, that is very alarming. Myopia progression is the biggest, you can say, biggest problem in eye care now. Because
Okay.
if I see in my career for 24 years, the myopia progression, what we were seeing in past was around 0.5 diopter in a year on 1.5 years. Now, most of the children are showing around 0.75 diopter, 1 diopter change, even in 6 to 8 months.
Okay.
So the number is changing very, very regularly and at a very high pace. So our kids are going to be high myopic in near future.
Okay.
The only cause what we can correlate is stress, any kind of stress. That is directly related with this myopia progression.
I think this stress, along with the nutrition factor, also emphasizing the same, because obviously when I'm not eating properly,
Yes.
that is also creating a problem on that. So how
Yes, ma'am.
parents can put a check on that? Because obviously when the kid is growing, say the adolescent age, they don't want to listen easily. So in that, how to make them understand?
Ma'am, first of all, we have to be the friends of our kids. And now what I feel, the IQ level and the understanding level of our kids are better than ours level at that stage. So we first of all, we should not underestimate them. They are better, exposed to all the things. They know better what is going to be harmful for them and what is going to be a good thing for them. The only thing is, whenever we try to impose something on our kids, they react. So we should tell them, there are a lot of things available on media also. Like we can say, like if you are doing a lot of digital work, or if you are eating, these are junk food, it is going to harm your this thing. It is going to harm your health. It is going to harm your vision. They are, and they, what I feel, they can understand it, but the way we should take a way, in that way they should learn whatever they, if they, you can say, if they are very, what do you say? We have to, sometimes, like the in advertisement companies, what are they doing? They are taking your role models to convey that message.
Correct.
So, we have to be little smart in that way. Whatever is the role model of your kid, use that role model, or different media, different things. Like there are a lot of things, but we have to be focused on their nutrition, because nutrition is another factor which is going to affect the health as well as the eye. In myopia progression also, vitamin D deficiency is a factor which is related. So we have to tell them, but every time if we tell them the things in a, administrative way, they don't listen. So we have to take out a way. We have to be the friends of our kids first, and then we should convey our message to them.
So
But that is very important.
Yes, ma'am. So we should be very much a low down, I can say, because adolescent child will not listen to your commands all the
Yes.
time. So you have
Yes.
to
You
be
have to
very
be, you have to be the friend of your child
friend
first.
of your child to make them understand. And this idea is very good that through advertisement, through their role model, we can make them more aware about it, and we can make them understand ki, see, if he is not doing, you are following him or her. So you can also take them as your further role models. So that's a better idea. Thank you for giving this idea. Ma'am, this any kind of techniques which can help them children to avoid the progression, myopia progression, any kind of technique or any kind of activity?
Yeah. In myopia progression,
Mm-hmm.
we follow simple 3 rules. First of all, environmental modifications.
Mm-hmm.
Second, there are specialized glasses and contact lenses available,
Mm-hmm.
and medicines.
Okay.
So I always emphasize on the environmental modifications first. We should create an environment which is helpful for them in the case where the myopia progression is not that high.
Mm-hmm.
So in environmental modifications, first, lack of outdoor activities, it creates myopia progression rate faster. So what we have to tell so we have to tell our kids, go out for at least 2 to 3 hours for playing, for distance activities. No to digital gadgets or limited use of digital gadgets, which the amount which is actually required. Now, most of the parents are saying that whole homework is coming on the digital gadget. How to stop that? So nowadays, if we say that totally rule out the digital gadgets from your life, it is not possible. But we can make a limited use of digital gadgets. If the homework is coming, try to use a bigger screen, laptop or desktop. Please don't use any tab, mobile or small screen for all those things. For recreational activities, try to watch TV from a distance for half an hour or so. And good light, proper sleep of 7 to 8 hours. Vitamin D deficiency, we have to take care of that part also. And whenever they are sitting, the posture should be straight. They should not lean down and lie down and doing all the things in bad posture. Their correction should be properly corrected. Even under correction of 0.25 diopter creates myopia progression rate faster. So in crux, we can say a lot of outdoor activities, limited use of digital gadgets, proper diet, proper sleep, proper posture. These are the 5 things which are important in environmental modifications. In addition to this, I always suggest parents make their reading area towards the balcony or a window side, so that whenever they are switching their focus, they are able to see a distance target beyond balcony. And it should be beyond 6 meters or 20 feet. In most of our houses, our reading area is in a small room. So whenever the child switches the focus from digital gadget or a book, it looks at the wall in front of him. That's only 30, 50 meter away from him. So again, we are making a cubicle kind of thing. So there should be a switching of focus from near to a distance target. Whichever distance we can provide. So the child should be seated in front of balcony or a window side. These are the environmental modifications that we should be doing for all the kids. Other than this, still we are facing that myopia progression rate is very high. Means if it is more than 0.5 diopter in a year, we consider it as a higher progression rate. Other than this 0.5 diopter, we have to look for the age of the child and present number. Because our number changes up to the age of 18, 19 years. So we have to consider age, present number, and rate of progression. If we feel that in spite of doing everything in environmental modifications, kid is still showing the progression rate high, we have to go for the other techniques like special myopia management glasses. They are specially meant to slow down the progress of myopia. They are specially designed lenses. There are a lot of multinational companies which are providing all myopia progression management glasses. There are different which is called ortho K contact lenses. Those are the contact lenses which are special contact lens which we ask the child to wear during sleeping time.
Okay.
And once in the morning the child awake, remove the contact lenses, vision is clear without any glasses, without any other type of contact lenses for the next 12 hours. And we repeat the same.
Okay.
These two things are giving very good result in slowing down the progression of myopia.
Okay.
Third is special drop which is called atropine drop. There are low dose atropine drops, 0.01%, means still at the time of sleeping at night. And it also reduces the progression of myopia. But atropine drops are basically affecting your ciliary muscles, the muscles which are responsible for accommodation and clear vision at near. So sometimes it creates different, effects also. Child is not comfortable during sunlight because the pupils gets dilated. And we are directly affecting the ciliary muscles, the activity of the muscles. So generally, I am not in favor of putting drops in kids. The best way is glasses because it is non-invasive method. Contact lenses, drops are invasive methods we are putting inside the eye, but glasses are the safe and best method to slow down the myopia progression. Sometimes we have to make the combination. So it depends on the situation.
Case to case.
Yeah.
So ma'am, if parents can make it possible to reduce the gadgets at home, because when they are themselves watching the gadgets all the time, it can make the kid also to understand कि आप देख रहे हो तो मैं भी देख सकता हूँ.
That is the situation, ma'am.
That is the situation. And taking them out of the house, though to nowadays both are busy, but it is their responsibility to take care of this thing because it is growing in a very faster pace. What I understood.
It's a pandemic, ma'am. It's a pandemic.
So better not to make it more dangerous for everyone, and because obviously it is creating problem in eyesight. आंखें हैं तो सब है, अगर आंखें नहीं होंगी तो हम चलेंगे कैसे? अगर मैम मेरा एक लास्ट क्वेश्चन है, अगर ये हुआ, मुझे हुआ या कोई केस आया, कोई बच्चा आया, अगर ये एक डिटेक्ट हुआ है तो क्या उसको फर्दर जो आपने प्रोसेस, जो आपने पॉइंट्स बताए, उससे कंट्रोल किया जा सकता है, जितने भी आपने पॉइंट्स बताए अभी?
Ma'am, 100% control is not possible because it's a growing process. But we can slow it down up to a very higher extent. Means suppose a child is showing one diopter change in a year. We can slow it down. Maybe he will show a change of next one diopter, maybe within 3 years, 4 years. Okay. So we cannot say like we can stop it completely, but we can make the progression rate very slow. Okay. That is our aim. But whatever I have done, like I am doing the study on these kids for the last 2.5 years. And for the last 2.5 years, I have not seen any change in any of the kids' classes. Okay. For the last 2.5 years. So I am doing that study. So let the study, maybe 6, 7 years over. Then I can give you a better answer of this. But till date, I have not seen any change in my kids for the last 2.5 years. Wow. So these things are very promising. And we have to move with the world. Whatever options are available, we should do it with, with the full religious approach. Obviously, when the world is changing around in a very fast pace, and we cannot say that we will be out of this world totally. It is not possible. Yes. It's not possible. To be in touch of the world, we have to get in this internet web, but yes, with proper control. As you said, environmental controls can be made, environmental options are there, which is to go out and play, which is to sit for vitamin D, look for your nutrition, and check up for the eyes also important. If the every 3 months, every 3 monthly. For every all the age group or different ages? It is up to the age of 18 years. If the child is showing progression, we say 3 monthly checkup. If the child is not showing any progression or no refractive error, we say 6 monthly. And after 18, 19 years of age, it should be once in a year. Okay. So coming back on the Women's Day note, where do you find yourself as a woman? Ma'am, I am a professional. I am a mother. I
Mm-hmm.
am a teacher of my students.
Mm-hmm.
And what all role you can say, like,
You
I
can
am
say
trying
as
to
many roles as possible, mother, daughter, teacher, and
mother,
everything.
daughter, teacher. Yes,
These are the main roles which we all are playing. We have no
we all are
doubt.
playing.
But
We all, as a mother, we are the first teachers
yes.
for our kids. As a professional, also, I'm a
Mhm.
teacher. There are a lot of students
Mhm.
who did fellowship under me, and they are still doing PhDs and all under me.
Mhm.
So, as a professional teacher, also, and professional, and I'm a pediatric eye care practitioner. So, I am a role model for many of the kids. Few of
Mhm.
the kids have grown up and they are doing ophthalmology. They have become the eye specialists now.
That's great.
So, so there are lot many roles that every
Mhm.
one of us are playing. So what I can say, like, women have the highest numbers of roles what they are playing every day in each and every day of in our
Yes,
lives.
ma'am. So your mantra on Women's Day will be?
Stay focused, stay tuned, and whatever is coming, like, update yourself every day. What I'm doing for myself, and I'm trying to tell my kids also, like, we have to be updated every day
Mhm.
because world is changing, so we have to be stay focused, tuned, and updated.
Thank you. Thank you so much, ma'am, for giving your valuable inputs. And obviously, I'm going to share this recording on YouTube very soon. And I request all the parents to watch this. And if any one of the parent is having any kind of issue, do check with Dr. Shalini Jain. Clinic is at Vaishali. Samyak Eye Care is the name of the clinic. She will be of a great help. And don't wait कि लोग क्या कहेंगे. लोग तो जो कहना है वो बाद में कहेंगे. पहले आप खुद जाके देखिए कि जो बेस्ट हो सकता है वो करिए अपने बच्चे के लिए. Thank you, ma'am. Wish you a very happy
Thank you,
Women's
ma'am.
Day. Thank you so
Same
much.
to you, ma'am. Same
Thank
to you,
you.
ma'am.
Thank you so
Thank
much.
you.
We'll connect again soon. Thank you, ma'am.
Thank you, ma'am. Bye-bye.